Good afternoon, everybody. Thank you so much. It's my pleasure today to take a few frequently asked questions. My name's Professor Janet Ngozi Ajuluchukwu. I'm a consultant physician and cardiologist working for the Lagos University Teaching Hospital, and I'm also a professor at the University of Lagos. And it's my pleasure to be here today to talk about hypertension. I'm going to deal with some frequently asked questions about hypertension. Hypertension is also known as high blood pressure. World Health Organization tends to want to call it high blood pressure, but the medical people call it hypertension. What causes hypertension? Well, hypertension is a disorder or a condition where there is an elevated blood pressure. So the blood pressure is caused by the pressure of blood on the vessels, especially the arteries, and this pressure is imparted on the vessels by the heart. So everybody has a blood pressure. It is normal blood pressure for an adult. So we'll start with the adults. For any adult above age 18 and above, the blood pressure that is expected is supposed to be less than 140/90. So the cutoff point is 140/90. We have two measurements for blood pressure. The upper number, which we call systolic blood pressure, is the pressure in the blood vessels when the heart is contracting, and the lower number, called diastolic blood pressure, is the blood pressure in the blood vessels in the arteries when the heart is resting. So there is never a time that the blood pressure in the vessel will be zero. So that would be dangerous. So what are the causes of high blood pressure or hypertension? We have two basic types of high blood pressure. The primary hypertension is seen in more than 90% of the individuals who have high blood pressure, and this primary one has no known cause. But the secondary hypertension is seen in 5 to 10% of patients, and in this particular type, there is a condition in the body causing the elevated blood pressure, and these conditions can come from kidney disease, endocrine diseases like diabetes. Somebody could also be born with some issues where there are some absences of some organs or some anomalies in the kidneys that would cause the secondary hypertension. So coming back to primary hypertension, which is commoner and affects more than 90% of people, we have what we call risk factors rather than causes. So the risk factor means that in the presence of risk factors, a condition is more likely to happen but must not happen. So the risk factors for primary hypertension is heredity. So if one parent or two parents have high blood pressure, their offsprings, their children, are more likely to have it. And the operative word here is more likely. It's not a must that would happen. Then the other factors are diet related. The use of salt, domestic use, and in processed foods. So the fact that hypertension or blood pressure is rising is due to the use of processed foods, and that the fact that salt is used as a preservative. So whether you like it or not, we have what we call hidden salt. You might not even know that you're eating salt, but excessive use of salt increases blood pressure. Other factors are reduced or minimal use of foods containing potassium. And what are these foods? These foods are fruits and vegetables. So diets that are low in fruits and vegetables, vegetables and fruits can be very expensive now. These are all risk factors. So it all boils down to finances. Other issues are high fat diet, high oil diet. The other factors, also lifestyle related, smoking, tobacco use in any way, and alcohol, excessive use of alcohol. And some people don't even know that they are using alcohol when we find it in, socially people use alcohol. And then for medications, for concoctions, some people use water-based concoctions, others use salt, alcohol-based concoctions. All these are ways in which we increase our salt intake without knowing. Other factors that also risk factors will also, lately our research has shown that high income and low income, we have what we call a U-shaped curve. People at both ends, rich people or people that are in high socioeconomic status, they tend to have hypertension, and people in low socioeconomic status also have hypertension for different reasons. Then we also have a condition called obstructive sleep apnea, that can also bother the body, and the blood pressure will be elevated. Then for children, and even for children, a low birth weight, and this affects everybody. If a mother is bothered during pregnancy, if the pregnancy is eventful with illness and the child does not grow very well inside the womb, the child develops some protective ways to survive that illness and that stay in the womb, that will now, when they now come out as children or as adults, they would have developed some risks that would make them to have high blood pressure. So one of the frequently asked questions is, what are the symptoms of hypertension? In 2002, the World Health Organization decided to finally name hypertension the silent killer, because it is the leading cause of death of adults all over the world globally. Just left to hypertension alone, more than 9.4 million people globally will die. Then we have hypertension being associated with other conditions that we call cardiovascular diseases, to result in strokes, heart failure, heart attacks and things. So when you put all that together, about 17 million people will die of heart failure, of hypertension and other cardiovascular diseases. But hypertension by itself is about 9.4 million. So when WHO realized this, they decided to tell the world that this is a silent killer. So if we're asking for symptoms, hypertension in the beginning does not have symptoms. Symptoms are manifestations of disease that an individual can recognize. But we want to emphasize that high blood pressure or hypertension does not have clear-cut symptoms. The only way of diagnosing hypertension is to go to your healthcare provider and have your blood pressure checked with this blood pressure monitor that we call sphygmomanometer. This is a digital type, and this is a mercury type. It's very, very, very important. If we're waiting for symptoms, the symptoms that we are quite clear that follow hypertension are symptoms of the complications, So we just want to say that it is silent, and there is a reason why we call it silent, because it does not have symptoms. But vague things like headache, fatigue, and all those things that, but we don't want people to start waiting for headache. We want people who, adults to once in a while, check their blood pressures. That is the only way that we want people to. When I get to complications, I'm going to talk about how the complications will now manifest. So what are the risk factors and how can they be managed? So I mentioned some risk factors, and I mentioned dietary, poor dietary factors like high salt intake, low potassium intake, meaning that fruits and vegetables are low. If we want to help ourselves, we have to be cognizant of our salt intake and make sure that we have minimal salt intake, and fruits and vegetables that are rich in potassium, which will now negate the sodium. I mentioned that alcohol is a risk factor, so if we want to prevent hypertension and we want to control it, we have to minimize our use of alcohol. Cigarette smoking, the medical people say no to smoking. There is no little amount of smoking that is allowed, but a limited amount of alcohol is allowed in certain situations, and in certain conditions we will still say no alcohol is needed. So since we know some of the risk factors, we cannot change our heredity, we cannot change our genetic makeup. So if you know your family history, and the WHO also gave us some guidelines that we call know your numbers. If you know yourself, you know your age, you know your blood pressure. My blood pressure is 120/80, it means this. We don't just want you to say, I went to the doctor last week, he said it's okay. No, we want more active involvement, and you're owning your own knowledge. So we want you to know your numbers, know your blood pressure. It is 120/80, it means this, or it is 160/90, it means this, or it is 110/70, it means this. Don't just say the doctor, nurse, pharmacist said it is okay. We want people to know their blood pressures. That is the first number we want you to know. Another risk factors like diabetes, I know my blood pressure, my blood sugar, it is 100 milligrams percent. My fasting blood sugar, it is normal, or it is 140, and I was told that it is elevated. Then another risk factor is obesity. The bigger the person is, then the higher the blood pressure is also going to be. So controlling your weight, controlling your food intake, your calories is part of prevention and part of the treatment of hypertension. So what lifestyle modifications can be made to control hypertension? We've mentioned that if you know that your father or your mother had high blood pressure, then you must even be stricter on yourself and take care and start the prevention early. We don't want you to be 50 years before you do that. And we also encourage families, if you know that you have hypertension as a parent, you should also tell your children that there is a genetic basis. You're likely to have this. So as I'm eating a low salt diet, join me. Some families say, oh, we cook this for our daddy because he's on a low salt diet. No, we want everybody to be involved so that the children do not even develop it. So that is where lifestyle comes in. Everything in moderation, no smoking at all. No smoking for any reason. And you also avoid what we call passive smoking or secondary smoking. If you're in a place where people smoke, you need to know what to do about it. And the Nigerian health system has its rules about smoking. Then alcohol limited, and then processed foods. Eat fresh. The fresher your food is, the more you're preparing your own food, you will know what to put in it, and the preservatives that would help. In limiting salt, we encourage use of spices and vegetables and pepper and things like that to give it a taste. So these are some of the lifestyle things. So what the next question is, what medications are typically prescribed for hypertension and how do they work? So hypertension commonly comes with other factors like diabetes. There are many strategies of treating hypertension, and we want the populace, and that is what the World Hypertension Day is all about, for education, that the more people know about this condition, that it is silent and it could happen to anybody, and that age is a risk factor. The older you are, the more likely you are of having it. So coming to the medications, there are many strategies of treating hypertension, but one of the strategies that we commonly use is called individualized therapy. So you would hear friends saying, my blood pressure is 140/90, my doctor gave me this medicine X. And another one will say, oh, my own was even 140/90 and I was given another one. So we do individualized therapy. If a patient is a woman is in the reproductive age, is obese, has factors like diabetes, asthma. If a man has prostate problem, if the patient has developed some complications, some of our medications, apart from reducing blood pressure, can also prevent or minimize complications. So if somebody has a tendency already, showing a tendency towards kidney damage, then we are going to give kidney protective drugs. So therefore 140/90 is so different in many people. Somebody who has 140/90 blood pressure plus diabetes, we have some recommendations from our authorities, especially WHO and research, telling us that for people who have diabetes, there are some directed medications that are for them. For people who have asthma, there are some of our medications that can cause exacerbation of asthma, so we avoid them. And there are some of our medications that are safer for them. So when you know a patient in totality, we direct our medications to the person as a whole person. So it is not just that the blood pressure is 200/130 that is important, but the totality of the person is also. So if I may call names, we have classes of what we call WHO classes of drugs. To remind students and to remind everybody, we try to do it in an alphabetical order. So the alphabetical order for drugs, we have drugs that are called ACI, and we commonly call them ACE inhibitors because there are so many acronyms. So angiotensin converting enzyme inhibitors are one class, angiotensin receptor blockers are another class, alpha blockers are another class. So we try to say AAA just to remind ourselves. The other drugs are beta blockers, the other ones are calcium channel blockers, and we have many drugs in the calcium channel blocker group, like amlodipine, nifedipine. These are commonly used. The D are our diuretics, and of course diet. So this is the way we try to remind ourselves of what to do and how to choose our drugs. But all these classes, WHO classes, they are directed at certain problems, which the totality of the person is helping us to take those decisions. So how is blood pressure monitored for someone with high blood pressure, with hypertension? So self-monitoring is very, very important now. So now it is a teamwork. Don't just come to the doctor and say, solve the problem. So every day, research, social medicine, and everything, we are seeing that we are doing what we call a patient-centered care, but it is also a teamwork where the family is involved, where the patient knows what is going on, not just passively following instructions. And so we want, so when the patient, when the individual or client comes to the doctor, we see them for 3 to 5 minutes in terms of blood pressure measurement. But the patient is at home for 24 hours. So home blood pressure measurement is so important. And so there is, there is a high, support for home blood pressure measurements. Because when the patient comes and tells us, oh, today your blood pressure is 140/90 in the clinic, and the patient will say, no, I've been having 130/80 at home. We believe that because in the hospital environment, the traffic to the hospital, the stresses in the hospital, there is even an entity called white coat hypertension, because white coat hypertension is a name given when there is an elevation of blood pressure in the hospital environment, because many people wear white, and so that is just what the name that was given to it. And the patient will bring their monitoring books and say, oh, look at my blood pressure. And once we establish that their own blood pressure monitor was normal, we agree. And then we take into consideration that yes, it is 140/90 today, but yesterday it was 130/80 at home, because they are in their homes and at their workplaces more than they are with us. So we want them to monitor their blood pressures. And now we want there is a need for every hypertensive patient, every family to have their own blood pressure monitor in their own homes so that they can monitor. Is there a rule about how many times a day or how often? If a patient is stable I usually say 1 week. There is no hard and fast rule about how many times they would monitor. And also at home, we also want that blood pressure that they are doing to be well done. So one of the themes for this year, and it was also the theme for last year for World Hypertension Day, is accurate measurement, and for the patient to know that this measurement is done appropriately. So we are empowering the populace, we are empowering the clients, we are empowering the patient to know what is going on. When they come in to do their blood pressure measurement at home or even in the hospital, they are supposed to be seated for 5 minutes. And then they have to sit in such a way that their legs are firm on the ground, their backs are supported, their legs are not crossed, their bladder emptied, their hands on the table, they monitor their hand and their heart at the same line. Such that when it is done, if you're slouching forward or you do it on your bed, there is something that is happening in your body, in your tummy, that is going to change that blood pressure if your back is not supported. So we want the healthcare providers to do the right thing. We also want the patient to say, oh, nurse or doctor, please, I'm not comfortable, or I'm not seated for 5 minutes, because sometimes we want to be, we may want to be in a hurry, but if they are not seated and they have just walked up, physical activity increases blood pressure. If they have not rested well, and you say, oh, it is the chief of my town that has just arrived, I don't want to delay him, you will give us a wrong reading. Okay, so it has to be done properly. So one of the reasons and themes for this year is measure your blood pressure accurately, control it, and live longer. That is the theme. So when the healthcare provider is not trying to follow the rules, let the client say, please, I want to rest a little bit more. They are not supposed to have smoked or taken any caffeinated drink 30 minutes before that blood pressure measurement. And we also want them to empty their bladder if it is possible before the measurement. So coming to complications, and that is where I crave your indulgence. When I'm talking about hypertension and heart problems, I put on my red cap to say that there is danger. So what are the dangers of hypertension? It is silent, and it is gradually doing things in the body that we are not. So nobody knows the first day that their blood pressure will start, but the more regular you are with checking anytime, and that is the rule, especially in LUTH. Even if you come with a nail puncture, we'll do your blood pressure. If you go to the staff clinic, we'll do your blood pressure. If you go for asthma clinic, we will do your blood pressure at any contact. If you're coming in as a new staff, you do your blood pressure, so that we will know, because it has been silent. For the students, when they're going to secondary school, we say do your blood pressure. And some parents would even, want to say no to that, because it is silent. We don't know when it's there, and the earlier we start the treatment, the better. So coming to the complications, we have what we call target organs that hypertension can damage. Hypertension damages vessels. It's just like the pressure in your car tire, or if it is too high, it will rupture. So you can imagine rupturing of a vessel in the brain. It will cause a hemorrhagic stroke. Okay, when the blood pressure, if the blood pressure is so high in the nose, the vessels will break and rupture. It will cause bleeding from the nose. It is one of the causes of bleeding from the nose. If the blood pressure is high, the heart tries to counteract that hypertension. The heart gets enlarged, and so the enlarged heart is part of what will happen. And then if the enlargement will delay heart failure for some time, but after a while, if it is not treated, there will be heart failure. The high blood pressure, hypertension, damages the kidney. We have a two-way traffic with the kidney. Kidney problems cause hypertension. Hypertension also causes kidney damage. So these are, and then it also causes blindness, because it causes bleeding and rupture of vessels, and we have vessels in the eye. So there are some changes that happen in the blood vessels, including that they can get narrowed because of hypertension and some other risk factors. And if there is a rupture of blood vessels in the eye and it covers a particular area where where we call the macula, where the sight is directed, then the patient might become blind. So these are some of the complications, and we don't want that to happen, and that is why we want it to be picked up early. What should be done to prevent hypertension in the first place? Knowing your history. If your parents have hypertension, my mom had high blood pressure, and I knew that I could, but to God be the glory. My blood pressure is 1170. Yes, my blood pressure is 110/70, because I'm very, very aware of that, and I know what I eat. I'm very low salt, I'm very fruit directed, and up till now I do not have it, and I will not tell you my age at this point. Yes, so in my own case, I would say that it has been prevented because I know my history. So what are the other reasons? Once we do our blood pressure checks regularly, we are likely to pick it up early, and we are going to do our lifestyle management, and if we have some rules for those who will start medication, and the medications are very, very safe, and we know how to use them in a safe way. So the important thing, and then we also have what we call primordial prevention. Primordial prevention is the government making sure that all our food that is being in the supermarkets imported, that they have a reasonable salt content. All the education on radio, do your exercise, physical activity, look after yourself, reduce your alcohol intake, do not smoke. All these general things are part of the primordial prevention. Then we also do what we call primary prevention. Primary prevention is, I know that we call that high risk. You know who you are, you know that you're overweight, you know that one time you went you had some stress issues, you checked your blood pressure, it was 140/90, and someone tells you, please come back in 3 months time to check. All those things are preventive steps. You know that you have diabetes, and diabetes commonly comes with high blood pressure, and then you keep an eye on it, and then you make sure that it's not happening, but when it happens, it is treated. So these are all parts of prevention. Then we do what we call secondary prevention. The high blood pressure has already come, and I'm treating it so that it does not damage my kidney. That is secondary prevention. And then also, if it has already come and there is any target organ damage, I'm treating it so that it does not cause mortality. That is also part of prevention. So all these are different types of prevention that we do. Are there alternatives for complementary treatments? For me, personally, there may be alternative treatment. I would like to just keep to lifestyle, do your physical activity, avoid stress, be happy in your work, know your numbers. Alternative medicine, taking extra things, because we're already giving patients many medications. Personally, I do not encourage doing some extra alternative treatment, but we know that lifestyle is very, very important. Physical activity, limit your alcohol, low salt diet. So I would want people to kind of concentrate on their lifestyle modifications rather than buying some extra things like yoga, or taking some concoctions that they are not very sure of. We already have research medications that are doing the right thing, and I would just say let us keep to this rather than to spend more money and then do experiments that we are not very sure of. Conjunction with other health conditions. As I've mentioned it, that is even part of what we call profiling the patient and knowing the patient. So of course we know that there is what we call drug-drug interaction. So when you're treating peptic ulcer, when you're treating diabetes, treating hypertension, treating asthma, some of the medications interact with each other in a negative way, causing more adverse effects, or in a positive way to enhance. And that is why, we know our drugs, we know the person's condition, and then we give drugs, and then WHO calls it compelling indications and compelling contraindications. When a patient has multiple problems, you are compelled to go in a certain way. There are instructions that we have been given, and WHO calls it compelling indications, that when someone has diabetes, these are the drugs you have to use. When somebody has asthma, these are the drugs you have to avoid. When somebody is pregnant, these are drugs you must never use. So we call them compelling indications and contraindications. So that is why we are not in a hurry, and 140/90 means different things to different people. So thank you for listening, and we thank the LUTH management for joining forces with us for the 2023 World Hypertension Day, and I thank you for your attention.